Welcome everyone. My name is Daniel Stein, and I'm the co-founders of Stewards of Change and the National Interoperability Collaborative. Welcome you today to an ongoing series we're calling In the Nick of Time. And today we'll be talking about administrative data as a strategic asset and from the National Interoperability Collaborative. This is being presented in large part by the Pew Charitable Trust Fund and partners who have been part of that initial strategic asset plan. And let me move to the next slide here. Okay, some housekeeping for folks who are who joined us here. We are recording the webinar and we will post it to the hub. And at the end of the presentation, we'll show you the URL, but it is the, and actually Mike, you might want to put it up in the chat box for folks to take a look at the National Interoperability Collaborative, where we have a group that we are working to aggregate information about from webinars like this. You are probably muted now. You have the ability to unmute yourself if you want to join in. We'll be asking questions during the presenters, during the presentations. So feel free to do that. There are a couple of things. You can view the webinar through your computer, listen to it through your computer or through your audio through your phone. And as I said, we do want to hear from you, so please use the chat box and or raise your hand to ask questions. We want to try to make this interactive. It is always a challenge on webinars to do that, but feel free and be ambitious and break into the conversation as needed, as you like to. And please sign up for the Interoperability Hub, and or if you're already a member, go ahead and add to your profile. And so let me just, I've got a little bit of a delay in my, there we go. So our speakers today are Amber Ivy, who's the manager of civil legal system modernization at Pew Charitable Trust. Susan Smith, the director of Office of Research Evaluation, Connecticut Department of Family and Children. Chief Executive Office from Tony Fung. And also yours truly, Daniel Stein, who, as I said, is the one of the co-founders of Stewards of Change and the National Interoperability Collaborative. I wanted to just spend a couple of minutes giving a brief overview of the National Interoperability Collaborative for folks who may be new to it or not familiar with it. I want to share this resource with you since I think we think it's a valuable resource for the national community. And the NIC, as we refer to it, is a community of networks really designed to increase collaboration both within and across multiple domains to improve health, safety, well-being, and overall system operations. And the NIC was started about 2 years ago with a grant from the Kresge Foundation, and we've been building it out, and actually it's gone live as of last August. We're very excited about it. It's been a long journey to try to bring together in one central place resources around data sharing, interoperability, improved outcomes, and we're excited about it, and we hope that you will join and participate in the conversations. The idea here is to, as best we can, represent the various domains that are participating in health and wellness and well-being, and these include both human services, public health, education, public safety, emergency medical response, and healthcare IT. Looking at this as a systems approach, we are trying to represent each of those voices, since we know that complex problems involve many of these domains, and that one of the things we're trying to do is to help create the linkages and the connections between those domains so that people, as they're working on complex problems, can really view the solutions and the operations from a variety of perspectives. About a year and a half ago, we published a paper called In the Nick of Time, the 6 domains so if you're interested in learning more about that, it kind of outlines each of those domains, looks at sort of the policy, technology, some of the legal frameworks and also some of the underlying funding and resources that are along with that. And that's really the foundation for a lot of the work we're doing at NIC. It builds on more than a decade of our work with thousands of participants who have participated in our events, both online and in person. And we approach it as a system of systems approach. We convene and facilitate and activate stakeholders. We really view this hub as an opportunity to share best practices on things that have worked and have not worked. Some of the other work that the NIC is involved with is producing environmental scans, publishing findings and recommendations, and case studies and playbooks, and two in particular that I call your attention to, with which we have had prior webinars. One includes an opioid use disorder prevention playbook, which we just recently published, and also one that will be coming up in this next year, which will be a playbook on confidentiality and privacy. Playbook is a little different than a toolkit in that it includes very practical plays that can be replicated. We're excited about that. We've started 2 NIC chapters, one in New England, including the 6 New England states, also California, and we're in discussions with other individual states or regions to try to bring together from a regional perspective or a state specific perspective groups that would want to work together. We're able to and have been providing technical assistance and consultation, and our part of our work under the NIC is to provide webinars and education and training, and this webinar today is actually one part of that. So stay tuned and stay connected to us through the NIC. So far, just a quick review. We have over 500 members who have joined. There are 8 affinity groups, and we've had over 43,000 page views and over 4,000 visitors. So there's a lot of material and content there that people are finding valuable and useful, and I hope you'll avail yourselves to that. And so with that, I want to mention just one more final thing is on the NIC site, you will find materials from prior webinars, both recordings, presentations, and opportunities to chat and talk with folks on these various particular areas of interest. So we look forward to your engagement and participation, and I'm sure you'll be hearing from us as we go into the future. And with that, I'd like to introduce Amber. I've known Amber for a number of years now. I've had the great fortune of working with her and learning with her. She's been to a number of our events. And when they came out with this administrative data research, I was really excited about being able to bring it and be able to share it with our community. And so here we are. It's taken a little while to get to today, but with that, Amber, welcome, and let me turn this over to you.
Thank you, Daniel. Hello to everyone who's joined in. I'm super excited that we have 90 participants on the call, so it's really exciting. So thank you all for taking time out of your day. Our goal is to make this as impactful and resourceful as possible. I'm going to speak from the national perspective and what we found nationally. Tony Fung will come after me, and he's going to speak more so on his work in the Commonwealth of Virginia and how he applied some of the things we saw nationally at a state level in Virginia. And then Susan is going to follow up right behind Tony and talk about how she did this at a state level, but from the agency perspective. So hopefully everyone can learn a little bit from our call today. So I'm super excited to get us kicked off. So when I first came to Pew, I was brought on board to do a project called the Data as a Strategic Asset Project. And the goal of that project was to research the many ways that states use data to make policy, budget, and operational decisions with the real focus on how do states use data and data analytics to make those data-driven decisions that we so desperately need in a culture that's really driven off of data. So at the time when we came in, there had not been a national survey for how states could use their data. So we did a national scan, which included the 50 states as well as the District of Columbia, and we interviewed secretaries from various offices, including state auditors, legislators, secretaries of budget, different operational offices, different performance offices. And then we looked into one targeted policy area around health and human services, specifically around TANF, SNAP, Medicaid, and child welfare. So we were able to interview over 355 interviewees, and they really gave us a good idea of what was happening around the nation. Daniel, you can advance to the next slide. So that led to us coming up with this report, which is how states use data to inform decisions. So I'm not going to have time, of course, to distill this entire report in the next 7 minutes, but I do want to do some of the highlights. And at the bottom, you can see where you can get access to that report. But this report is done in a way that allows you to see different examples of what states are doing, and broken out in a way where you can literally just go into it, find what you need, pull out what you need, and there's icons on there and things like that that drive you to different states that are doing cool things around data, and it's a really easy to read report, so definitely check it out. So when we started looking into this, the first things we knew for sure was that people were using data for budgeting and reporting requirements to the federal government, and just to ensure that they were getting the budget they needed. But we wanted to go beyond that. We wanted to really figure out what were the 4 strategic ways states were using their data for decision making. So what we discovered through our interviews and after we did our analysis was that states were using data in 4 major ways. And you can advance, Daniel. The first way was to craft policy responses to complex problems. So what does that look like? For example, in Massachusetts, policymakers used data to better understand why people were dying from drug overdoses at such a high rate. And based on those findings, Massachusetts was able to pass a law to address the opioid crisis and actually were able to find what were the contributing factors, and then focus their focus on the types of treatment, education, and prevention that they needed based on what they saw in their data. The second is improved service delivery. For example, here, Missouri health officials use data to identify individuals who are frequently users or frequent flyers of the emergency room and who also had a chronic health condition. And due to them using their data, they were able to identify which patients were high cost and assign caseworkers to those patients in order to help them get coordinated care, which therefore improved their outcomes. The next one is manage existing resources. So that's really important. We're being given taxpayers' dollars, so making sure that we understand how to use those resources in the best way is a really important way that states are using data strategically. One good example is from Delaware, where they attached GPS devices to their state fleet vehicles in order to understand how the vehicles were traveling around the state. They used the data to understand how they could reduce the miles driven and the fuels used, and they saved nearly $1 million over a 4-year period just by looking at the data from their GPS devices. And fourth is examine policy and program effectiveness. So when you use your data, we shouldn't just put out programs and not understand what's happening. So a lot of states are using data to understand how effective their programs are. And one example of this is in the District of Columbia, where they performed RCTs or randomized control trials to understand how to effectively boost participation in their summer youth employment program. And they were able to move some of their resources around based on what they saw in their data. So those were the main ways we saw that states were using data, but we realized that states are also encountering challenges used in their data. And you can advance, Daniel. So one of the biggest things we heard when we asked states about the factors that they were facing and what type of challenges they were facing when they tried to do data work, I actually thought that technology would have been like the #1 thing, but if you look at the slide in front of you, technology is in basically a 3-way tie at number 5, but the #1 issue is staffing issues, and that also includes skills. So a lot of people were concerned that a few things, they didn't have the staff they needed, they couldn't pay the staff the amount that they needed for them to do data analytics work, and that they just weren't able to retain that type of talent for a long time. They would leave if they did get them on board. But the beauty about that is there are plenty of states that are actually doing this work and have been able to use different types of modified versions of staffing and get very, very creative. And I believe Tony's going to talk about that a little bit later as well. The second area is data accessibility. So a lot of folks complain about, this isn't about data sharing. This is literally, I cannot access my data because my system is too old. So I can't pull it out, or we never track the metrics I need to do the work that I need to do because the system is too old, or we just never put it into place. So that's what data accessibility is. Third is data quality. So the quality of the data is not where it needs to be for us to do analysis. For example, in one state, if for the police officers, when they were typing in suspects, if they did not put the suspect's height in, it automatically defaulted at like a ridiculous size, like 5'2". So then if they didn't put the right data in, all the suspects were 5'2". So showing that if you have gaps in data, now if you run that report, it's inaccurate and it's not correct. So just making sure that you're understanding how to get your folks at the individual level, using their data, understanding why it's important to make sure we all understand the definitions, we all understand what's going into those fields, and making sure our data is quality. And then the last thing I want to hit on right now is data sharing. So one of the things that NIC does is they increase collaboration across domains, but it's very important when you're doing that type of work to share your data. So earlier, Daniel mentioned all the different types of policy areas that are sharing data, but right now in the government, we have problems just alone in sharing across our offices, sharing across agencies, sharing within our state. So it's going to be very hard to share across agencies and policy areas if we haven't built a culture that allows for data sharing. So those are the challenges that we found that we're facing states being able to do this type of work. Advance to the next slide. So on the opposite side of things, we asked states about what actually made them or helped them to get this data work going in their state. So the first thing and most important thing was leadership. And that wasn't just leadership at the top down level, it was leadership from the bottom up as well. So having champions throughout the entire agency was very important. The next one, which makes sense, is staffing. So I know one of the challenges was staffing, but on the reverse, having the right staff in place definitely proved to be something that was super helpful and impactful. And then third was data sharing, which again, with this work, especially when you're talking about issues like the opioid crisis or dealing with health outcomes, you're gonna need access to data that's beyond just your office, your agency, to actually really get some good outcomes. And so after we looked at how states were using their data in strategic ways to make decision-making, the challenges, and the supporting factors, we were able to analyze the data and we came up with five key steps that states can take to do this type of work. So these are the 5 key actions that states can use to promote data-driven decision-making. So under each one, we have three principles. So the first is plan ahead by setting up guiding goals and structures. What does that mean? It's creating a data strategy, developing data governance, and taking stock of systems. Tony's going to talk a lot about that and what they did in Virginia next, because they did a really good job of developing data governance, promoting the use of standardized data and shared data definitions, managing information as an enterprise asset, and increasing their data sharing. They also partnered heavily with their universities. They put into place some things around like chief data officers, but he'll go into more detail of that. But they were able to really put together a really good plan that helped set them up for success in the state. Second is build capacity. So build the capacity of stakeholders to effectively use your data. So what does that mean? You hire skilled staff. You leverage the partnerships that you have in the state. I know one of the biggest things we heard from folks is that they weren't using their universities in a way. A lot of these universities are state universities that can be leveraged to do research or different things like that in different partnerships with, which you'll hear a little bit about later. And then finally, you need to actually have someone dedicate funding to this and secure grants that allow you to support data-driven products. Because it doesn't matter if you plan and then build capacity, capacity has to come with some funding that says we are actually focused on making this important in our state. And a good example of that was in the District of Columbia when they created the lab at DC, which uses data analytics to inform their government decisions. They've got some funding from a large philanthropy, and they've been pushing forward to make that a part of their government. Third is share. So ensure that quality data can be accessed and used by stakeholders. That means improve data quality and access, develop enterprise view of data, establish data sharing agreements. And the example I told you earlier about the crafting policy responses in response to the drug overdoses in Massachusetts, they're a good example of really putting things in place to make sure they had access to data. They actually got data from over 10 different agencies, so they had 10 administrative data sets, and they were able to look at that data to see what was happening with the opioid crisis in their state and make really good policy decisions with that. They couldn't have done that had they not decided to share data across agencies. Fourth is analyze data to create meaningful information. What does that mean? Analyze your data to extract information. Visualize your data. So if you're going in front of a leader, it's very important that you learn how to take that data and make it make sense to them. Use finding, and then use those findings to make decisions. So that's maps, infographics, whatever it is that you know your leader needs to be able to see this. Stories. Think about the opioid example. This crisis has been going on for some time now, but when we start seeing pictures and stories of what was happening to people in our states and local areas, people started galvanizing around that even more so because they could relate to it. So how do you take the data and the numbers, which we've seen for over a decade and that this crisis was happening, how do we actually take it in a way that makes people really understand what's going on and want to do something and take those findings to inform or alter our decisions? And then finally, you have to sustain. So if you do all of these things and you don't sustain it, we just get to the point where most bureaucrats will agree that a new leader comes in, changes things, and then next 4 years is going to change again. But we don't want people to think that way. We want people to really look at this data-driven decision-making as a part of the culture. So how do you do that? You sustain support for continued data efforts through 1, enhancing your leader's commitment, 2, enacting legislation, and 3, the most important thing is changing the culture. If you don't change the culture will always revert back to what it originally believed in or what it originally stood for. So making sure you have a good plan for that. Texas was a good state who actually did a few things some years past. So I believe it was back in 2011 or so, don't quote me on the date, I know it's in the paper, but Texas implemented a statewide data coordinator position, which focused on improving data sharing and collaboration across state agencies. So they had that a few years before. And then Hurricane Harvey came, and the state was able to use the framework they had put into place by the data coordinator and the stakeholders to actually map GIS data and provide real-time information, which helped first responders identify the most vulnerable citizens and places. They also used the data to figure out which schools could open and really did a good job of using their data in a way that moved beyond just this whole idea of the data coordinator position, but really was used for disaster recovery and relief. So those are the 5 key actions. Once again, you can see the entire report above, and I want to turn it over to Tony to talk about the wonderful work he's done in the Commonwealth of Virginia.
Thank you, Amber. First, I want to thank Q and Stewart Change really for all their great work that's really helped out all the different levels of government and others to gain momentum in the data sharing area. And thank you all for joining today. Just wanted to first mention that to keep in mind, all of this, there's focus on technology, laws, and there's, different things that you need to get involved, policy, et cetera. But just try to keep in mind in terms of value and what is driving value and why. The question why, to share and, do data analytics. Because really, I think that really helps further the momentum and kind of breaks through a lot of the challenges. So with that, I just want to give a quick bio. So I was the Deputy Secretary for Virginia and Governor McAuliffe between 2014 and 2018. And a primary focus of mine was around increasing the use of data and analytics in the Commonwealth. So just a quick backdrop in terms of Virginia, we had a law on the books, and it still is on the books. It's the Government Data Collections, Disseminations Practices Act of 1976. So for the past 4 decades, there has been a law on the books in terms of governing data sharing, and it's been quite restrictive until 2018. So it really was very prescriptive. It was very restrictive in the sense that sharing of data was really not really the intent of the law. So it's very difficult to share data across agencies. There were penalties, very few exceptions over the years, and it created difficulties and a culture of little sharing, and the silos that we've all seen in our government was here in Virginia in terms of being built and hardened over those next 40 years. We also have a very conservative state in terms of a divided government. The data sharing topic really hasn't been a huge item in Virginia over that time period, but really gained a lot of momentum because Governor McAuliffe wanted to be able to focus on it to increase the value of the Commonwealth's delivery of services to its citizens. So really we took that on and really tried to identify how we can actually tackle through some of the barriers over the last few decades. So a couple of things that we identified were that we needed to have some modifications to the law. We certainly need to have culture change, as Amber had mentioned. We need to create capacity, as she also mentioned, and Daniel, as far as data sharing and analysis. Also, we need to develop a trust framework and create governance so that people can really, enter into this with the belief that they're able to make things happen in a very secure way because of all the other types of data sharing restrictions and laws that are out there on the books on the federal side, as well as any internal policies as well. And again, as I mentioned before, we got to be able to focus on value creation. So this was quite a bit of a marathon over the last 4 years during the administration. We certainly took a snowball approach, rolling it down the hill and having it grow bigger and bigger. And the intent was to be able to demonstrate in a smaller scope the value and be able to grow the trust and value from there. So to make change, you really need to involve a number of stakeholders. So at the state level, you certainly have your legislators. You have the governor's office. At the local level, it'd certainly be a mayor and city council. So it generally applies. And you also have some form of legal counsel. So we had our Office of Attorney General that needs to be involved in terms of being able to provide input and bless certain things. Agencies are extremely important in terms of change of culture. That's exactly where the execution happens. They have to be able to do the data sharing and the analytics and be able to execute on those things. And also, it can't be forgotten in terms of citizens and the private sector. You think about organizations like the ACLU, your tech councils, you have businesses. They all need to be able to come on board and see the value. So it's truly a team effort. You need to involve those stakeholders and others that apply to your particular area. So what do we do to make this happen? So first of all, is education and raise awareness. So we need to be able to bring everyone together and understand their issues. So it's a lot of listening as well as being able to strategize and plan. So we were able to have different things as components of that. So we had our first hackathon in 2014, and that was internal to be able to have our agencies compete in a fun way, to be able to understand what each other has in terms of data and how that could be used and develop solutions. So it's been very successful, and it actually continues to today, and it's grown bigger and bigger every year. We also had a data analytics summit. So we brought in the legislators, we brought in private industry, really for them to be able to see what we were doing and be able to hear from them, be able to understand where the value propositions are, where are the challenges. And from there, we took that and broke it down to a series of stakeholder meetings to be able to work out thorny issues, come up with common value propositions, and create solutions. In the executive side, we certainly took some actions. To Amber had mentioned turning universities. We had an internship program where we brought in university students at the graduate level and undergraduate level, and also to a certain extent, some of the faculty to be able to bring capacity to our agencies and be able to, at a very low cost or no cost, do that. So that was a very successful program, leveraging a state asset in terms of universities and giving students experience and some wins for the university as well. We also had executive order, EO7, for us to do an asset inventory, be able to share, that inventory, with the rest of the Commonwealth. We had best practices as far as that particular inventory, and also recommendations. So that really laid the groundwork for the legislation that was coming in 2018. So we also had the OAG. We worked with them to create bright lines on sharing. We had the governor's office and the legislators draft, the particular changes, and really zeroing in on value proposition. We focused on the opioid crisis. It sounds like others have as well, in terms of being able to drive value, and we certainly did that. We were willing to work with all stakeholders. We had a great champion, Secretary Hazel, who is the Secretary of Health. He worked with legislators and being able to reinforce the data sharing in his particular area of healthcare. He worked with us. He worked with public safety, and cut across those different areas to really bring together those stakeholders. And anyone who wanted to come into what we call the Commonwealth Data Trust, we were welcoming them in, and that included Pew and others as well. So that all led up to changes to the laws in the 2018 session. So we had Senate Bill 580, basically amendments to the Government Data Collection and Dissemination Practices Act. And that was really to focus on, increasing data sharing, but also leveraging analytics to be able to make use of that data. So parts of that bill were really about creating the first ever Chief Data Officer for Virginia. We also had a data committee in there as far as, supporting governance. And that included the governor's office, legislators, the OAG, academia, and the private sector. That's continuing support and being able to have them involved as we evolve this particular effort. And we also created data sharing capabilities for purpose and value. So the legislation passed, and the first thing we were required to do in terms of as a Commonwealth is to focus on creating value. So we focused on the opioid crisis, so state agencies, the Shenandoah Valley, Clarion, a company here in Virginia, really, took the new capabilities and shared across the state and local level. And it took, partnerships around health and public safety. As you can imagine, there's other layers of data sharing restrictions, and really be able to find the common ground, the driver of value in terms of helping folks who are afflicted improve their lives. So there was a lot of work that was done in that particular project to really demonstrate the value of changing of the laws, having a chief data officer, being able to share across these areas of public health and public safety. So that really increased our momentum. So now we have data sharing analytics types of projects fourfold in the Commonwealth, so that continues to grow in public safety, transportation, workforce, and commerce and trade. So it really has gained in momentum, and that snowball has really increased in size. So it really took a big vision, but also a very focused type of topic to really demonstrate value and have people come and pull along. Because you're going to come along challenges, whether it's funding or issues around data and other things. But if you have such a topic that people can really rally around, it really helps break through setbacks and disagreements and those sorts of things. So I advise really focus on that value at the end of the day. So with that, I wanted to pass it along to Susan.
Let me jump in here for 1 second here. This is Daniel. Susan, we'll get right to you in a second. There's a couple of questions that have come up. I want to just take a pause for a second. We'll come back for questions as well. But one of the things that always comes up when we talk about data sharing are, in addition to leadership and a lot of the things you've talked about, Tony, in terms of capacity building, is breaking down the barriers for data sharing. And I think that's a cultural thing that you mentioned. I think Amber mentioned that as well. They came up. But if you just want to spend just a minute or two here sort of addressing from a cultural perspective, what were some of the things that you felt were really effective at bringing people along on this grand vision? There are a lot of amazing things that happen in Virginia with leadership and with legislation and with really appointing the right people. But were there other things that you point at or that jump out at you from a cultural perspective?
Yeah, so I think that I would just go back to the word value. What aligns with the value propositions across the particular stakeholders that are going to have to change and make things happen. So I think that was the big thing. The agencies at the execution level saw the value in terms of the populations that they served, and it was a common population between public safety and health. So that really helped break through the cultural barriers of not sharing or having some issues around it. Certainly there's still the compliance that you have to have around privacy, security, et cetera, but there's definitely ways to share in an aggregate level or, in a way that still creates more value. So Daniel, to your question, I think really having those conversations and going back to why are we doing this and what does it bring to each of the stakeholders, we're able to find that particular area and really have everybody rowing in the same direction so that people can really give up a lot of the, throwing up, well, we can't do this, we're not able to, and be able to get very creative and help each other out, because the value proposition to everybody was so significant.
So I think what I'm hearing you say is you really took some time leadership took time to listen and to create the environment, the opportunities to actually engage in the kind of conversation that's necessary here.
Yeah, exactly. I mean, everybody has a what's in it for me, and it's just a real thing. So you really need to listen exactly. What do they need? How does this help accomplish their goals? Because everybody gets, government unfunded mandates piled on them. So you really need to go align this and say, how is this going to help these folks that are going to be involved?
Thanks. And I see Amber put up a comment as well in response to this. And I think, there's never it's always good to, leverage a problem to make change is essentially, I think, one of the main things you're saying here, particularly around opioids and other things like that, to bring people together.
Yes, and I want to add one more thing, Daniel. So one of the things that Virginia did so well around veterans homelessness is that they then create some big data system to share their data. They were basically looking at spreadsheets from across different agencies and local organizations that were nonprofits. And they were able to look at the data across those different agencies without building this big system. So even with the question about the barrier isn't the technology. It's just understanding that you need to create a culture of sharing, and that sharing could be us around a table talking through whichever veterans we have and how do we manage them a little bit differently and make sure they get what they need.
Right, and I think the point is with administrative data, many of the legal and barriers are not applicable here. We're not sharing identifiable information and it's aggregated stuff, right?
Yeah, so you have to definitely be mindful of, the compliance as far as privacy, et cetera. But there's certainly ways to create value without having to, cross any lines. And so I think, that there's definitely a way to get there. And I just want to point out one other thing that we did in Virginia is that we wanted to be able to navigate this properly. So if you think of a helicopter landing directly on the pad that it needs to get to, if you go one step too far in terms of technology and create more of a technology focus, people get lost on the legal side or on the mission side. So you got to really navigate. You're not going too far in technology, not too far in the laws, not too far in other areas. And I think that's where the value comes in. Is you focus on the value, those stakeholders can continue to articulate and understand where their piece of the pie is, and everybody keeps moving along in that direction.
Thanks, Tony. Let's hear from Susan now. Welcome, Susan.
Great. Thank you. Thank you so much. I'm really excited to share with you some of the work that we're doing here in Connecticut. And certainly in child welfare and child protection, it's really no different than many other human service organizations. And our end goal is, simply trying to produce positive and hopefully durable outcomes for the kids and families that we encounter and serve. And obviously data is really central to accomplishing that. And over the years, we've worked systematically and iteratively to create a culture, a climate, and infrastructure to embrace not only the value, I think, as Tony has talked about, and Amber, but also kind of the power of data. And we've also tried to do that in a vertically and a horizontal way. And really kind of what I mean about that is developing data access paths that extend across our agency. So our staff at all levels, from our direct service workers who are in the field all the way up to folks in our commissioner and executive offices, but also to go out across to some of our stakeholders and constituents. So again, very much what I think Nick's about and what I heard Tony speak about, and also Amber, in terms of how do you get other stakeholders and other collaborators and partners a part of this. Next slide. Advanced slide. So one of the things, So one of the things that we've tried to do is identify a variety of mechanisms and sources by which we can make data available to folks. So when that slide comes up, you're going to see a variety of portals and repositories that we've utilized and created to do that. So for example, we have a variety of internal repositories and data portals within the agency, and we also have some that are that are pointing outwardly, that are publicly available. So our link reports and our ROM reports are all internal, and they allow us to do our care management and do our performance management. We also, through our Office of Research and Evaluation, in which I'm the director of, we've created a variety of dashboards that help us look at various events and activities within the department, and particularly disaggregating and filtering those by race and ethnicity so that we can really get underneath whether or not our outcomes are occurring equitably. And we also then have a variety of, as I said, of sites that extend information to people externally. So, for example, the DCF Data Connect is listed on our website, and it provides a variety of more processed information. So you'll see reports on there. You'll see certain other data points that we've kind of analyzed and make available for folks to see. We also post data on the Connecticut Open Data Portal. And I think very similar to what I heard Tony speak about is that this was under the auspices of an executive order that then transformed into a statute that requires all executive branch agencies in Connecticut to provide data sets, machine-readable data sets on the Open Data Portal. So the department has provided a number of those, and going back for a number of years. So these are not identifiable, so the information is often at aggregate levels. But it does allow other stakeholders to kind of have access and kind of support, I think, kind of that crowdsourcing kind of a sense in terms of helping us to solve some of these complex problems. And also, I think, creating some real transparency and accountability within the department. I'm going to go back. I didn't talk about our PI system, and that's kind of quasi internal, external. And what we do with that is it allows our providers, our contracted service providers, to input information at a client level, so about our clients, that let us look at utilization and access, dosage, as well as outcomes. And so the providers are able to see all the data that they put in for their individual agencies, and then we as an agency are able to see all the information for all of our clients. So again, this admixture of both ensuring that we have broad internal access to data, but also trying to support some of that sharing and usage by folks who are external to the department. Next slide, please. And so, while obviously, kind of valuing the data and having that leadership aegis, around data is really critical, we found that there were some components that were really kind of essential to us for kind of pulling some of this together. And so we really wanted to think about how do we make sure that data is meaningful. And for us, it was very simply thinking about tying it to our agency vision, to our goals, to our performance expectations. And really kind of the collateral benefit of that is that it really kind of aided with the prioritization of data, but helped to kind of parameterize it, because it can be quite overwhelming. And sometimes I think you get a little bit lost and, kind of where do I begin? And it really helped to make it less overwhelming and less daunting and much more manageable. And so, when our performance expectation changes, then we, do some work on the data side on our dashboard sides to again, make it comport to the needs of the agency and make it more accessible to staff. So that kind of gets to the next piece of this, where and they talked about those various portals and repositories. It's really making sure that staff and other folks know where to get those, and that they're in various formats, and that folks at all levels are able to engage the data. So I talked about the DCF Data Connect, which are mostly kind of transformed reports and other things. And we also want to make sure that our staff internally have data sets that they can utilize, as well as folks who are external to the department that are certainly not identifiable. So this last slide here is an example of one of the data products that we've created using our administrative data. And folks who maybe have seen me present on other webinars related to racial justice know that this is something I use quite readily. But I think it's a really nice example about how you can use some of these data, how you can potentially visualize it, and really the multitasking that it does. And this allows us to look at disproportionality and disparity across our child welfare system. And we've used this to drive various changes within the agency. Policy development, it helps us to think about the equitability in terms of the services that we provide in terms of outcomes. It also has spurred for us development of some legislation. So just recently, We codified our racial justice commitment and value through an act in the statute that requires us to develop strategies to abate disparity and disproportionality. And we also use it to create policy. And so, you know, I'm not meaning to dissent, but I think in terms of augmentation is that, you know, as we started to think about, you know, data sharing and integration, as well as some of the innovation through predictive analytics and AI, we also wanted to be respectful and mindful about some of our families who may be more vulnerable, who are overrepresented in our system as well as others, and just creating kind of some thoughtful speed bumps about how do we do that right and well and protect our families' data dignity as well. So again, really trying to comprehensively think about the work that we do in here. Just one other point before I go, because I know the slide got advanced. The skill building of our staff, I think, has really been kind of critical to this. And that's an area that we've really done a lot of investment in, and it can be kind of fairly no cost, low cost. And some of it is done internally, that my folks in Office of Research and Evaluation will support training. We also are very thoughtful about the kinds of products that we create. And so, you know, we'll do a, 30, 40 page analysis of something, an evaluation or some research. But what we always are trying to do is create a one pager for our staff that summarizes, well, what's the takeaway for me as a social worker? What does this really mean? You know, how can I use this in order to get better outcomes with my family? How can I better prioritize my caseload? So we try to do some of that. We've also tried to take advantage of Pi Day. So on March 14th, we try to use that as an opportunity to get together with folks, have some food, but also talk about any new data reports that are available, any new products, but also try to explicate any research that we've done. So again, really trying to do this from a gestalt and totality of a way in order to try to hit some of those various areas that Amber spoke about. So that's all I have on that. I'm happy to answer any questions.
Thanks so much, Susan. A lot of material there. Sorry about advancing that slide. I don't know how that did. The Grum one.
No, that's okay. I wasn't sure if it was a timing thing. So, but I'm good. And if there's any questions, I can happily detail anything further.
Sure. Yeah. No. This brings us to the. We have a little bit of time here to address questions, or if people online want to make statements, that's also good as well. If you want to share anything that's got stimulated by some of the presentations, now is a good time to raise your hand or just unmute yourself and come on down, as I say. I'll wait for a moment, and then I have a couple questions. I hope others will join in as well.
Hey, Daniel, it looks like there's one in the chat box. Just to kick it off.
I didn't see that. Let me take a look at that. So there's a couple questions here. Rachel was talking about knowing whether or not there's examples of policy problems that are more focused on prevention or producing positive outcomes versus more downstream examples that were shared. So that's a really interesting question. We've been focused a lot on, particularly related to opioids, and looking to upstream, and can this administrative data help explain or project or sort of predict what's coming? So I'm wondering if anyone, any of our presenters or others have a sense of that as well.
Yes, so this is Amber. There are a few things. I know we started looking into predictive analytics or advanced analytics where you use your data to prevent outcomes, especially in child welfare. I know most of you have heard of Allegheny County and the work with that. Virginia has done work with predictive analytics as it relates to traffic and when to change traffic patterns or where they should put more police officers. Indiana has also done that. There's also been work on educational outcomes where you can do predictive analytics to figure out which students are most likely not going to, or who are ready for college, who are not applying for college, and get them what they need to make sure they're getting to college. So there's a bunch of examples that we highlight in the paper, and I'll post the link in the chat as well.
Okay, great.
I just also add in Connecticut, we too have adopted predictive analytics for some component of our child welfare system. But also, we've just used our administrative data to do pretty simple projections And so that has allowed us to look at the distribution of kids who may be in community versus in congregate care, so we can respond to that, or helping folks to foresee some of the seasonality with caseload. So even doing some of those basic forecasts and projections have been useful for us.
Yeah, and in Virginia, with the opioid crisis, as I mentioned, Shenandoah Valley and the project with them, the state and Clarion, they basically were able to do some analytics as far as understanding, more targeted as far as interventions and the type of resources. So be able to reallocate resources both from a operational real time, but also some predictive to be able to realign and also inform policy as far as different aspects, where health or public safety is involved.
Amber, there's a number of questions that have come up around what I would say is, those data that are, and those systems that are covered by, privacy laws and confidentiality. And I know working on the administrative data work, there's less restrictions on that. But I imagine as you were interviewing and as you were assessing, that there's kind of a gray space between how people are thinking about the use of data, the sharing of data, and where that sort of that bright line of consent comes in. Can you talk a little bit about that in terms of how you would address that and kind of the issues? Because I know that this wasn't focused on, particularly on confidentiality.
Yeah, so one of the things we thought we were going to encounter was that people were going to be afraid due to, like what you just said, HIPAA, FERPA, and other data sharing. But what I found is that actually the states that have been sharing their data were able to, like you said, de-identify that data in a way that they could share that data across different agencies. And the other thing to think about is, for example, SNAP, if I'm a person and I'm interacting with the system, whether it's healthcare, SNAP, TANF, you all already have all that information. So it's not like we're sharing new information about the person, especially around some of these areas. We just need to be very careful that it's not like we're sharing all this information with some entity that didn't already have access. This is like looking at if Medicaid office and the SNAP office aren't sharing information. I don't think we cross the same barriers that it would be if I share this information with like a private sector company or something like that. And I think the fear with a lot of people who work in state government, I used to work in state government, is that we're scared to share the data, and we really look at it as if though it's our data, but in reality, it's a state data asset. And so I think like what Tony talked about, and as well as what Susan talked about, and I think what Nick is really thinking about is this enterprise-wide view of this data. We're not saying go share the data with the Facebooks, the Instagrams, and all these people of the world, but we're just saying share within your state and across different agencies that are already within your state, because we do have that information already. If I have date of birth for Social Security and SNAP, I'm going to have it in Medicaid.
Thanks.
Yeah, absolutely. Amber's right. As far as the enterprise view, that's why I think chief data officer is not necessarily just, hey, we want to have one for the sake of having one. You need somebody at an enterprise level to be able to, create the trust framework and the governance, so everybody feels comfortable. They understand the rules of the road. Be able to apply standards, to be able to make the data more useful. All those things really at an enterprise level add a ton of value, and everybody can understand in terms of, citizen goes to all these different agencies and if they resubmit their information, part of the reason why is because of the fact that there's these silos that are put up. So there's a lot of inefficiencies that are created by that.
Great, thanks.
So Daniel, this is Dave Walsh. I have a quick question and open for anybody. The question is, are there efforts for interstate collaboration on some of this data, the format of the data, what's going to be included in the data? The reason that I ask that then is there's certainly a better opportunity for states or vendors to come up with solutions, analytics, artificial intelligence, machine learning, all that stuff, if they've got a broader pool of data to go after. So the question being, is there interstate collaboration on here's how we're going to format the data, here's APIs that are going to allow access to data, and so forth?
I think I could step in there just real quick, is that I think, there are some federal initiatives that help create some of that activity. And I think that, certainly healthcare, there's a lot of different things around fraud, waste, and abuse, and potentially other areas that are, driving that kind of sharing. I think that the federal government has a big role to play in whether it's grant funding or, other types of technical assistance, where they can drive a lot of that increased sharing by, putting some requirements in terms of around data standards and sharing across states where it's appropriate. So I think there's definitely a lot more opportunities for that. And certainly, federal government can use a lot of different levers. And let's not forget the local governments as well. They send a lot of information to the state and probably the federal side. There has to be some, reciprocal sharing for value that's happening as well. Otherwise, you really have a stakeholder that, not really getting, benefit and, just see it as a compliance exercise. So again, I think that if the federal government, state and local can really drive towards, specific purpose, I think a lot more sharing across states and local governments and federal will happen.
Super, thank you.
One thing I would add to that is the whole area of open data and the open data portals that over the last few years, many states, many municipalities really have put up. And that is those open data portals are, providing access to information that's produced by, government agencies now that has not been necessarily machine readable in the past. And I think what we find is in a number of places, a standardization of that data because of the solutions that are available. There are data sets that are readily available in many states now and at the federal government to really allow that to happen. And I would encourage you, if you're not familiar with open data, just to kind of Google around a little bit, looking for your open data, if your state or your county or city has it. Tremendous sense of a source of information. There's, I think we have time for one more question. There was a hand raised. I don't know if I have to enable you or jump in if you want to unmute yourself. Okay. All right then. What I will do here is thank everybody for joining the webinar today. We'll be posting this this recording at the on the National Interoperability Hub, and I'm going to just pull up that URL. I know Michael and company has been putting that up in the chat box. We'll put that up along with the presentations that have been made and as much of the information, questions that we can gather from there. I encourage you to come to that. In fact, Dave Walsh, who was just speaking before, is leading our Let's Get Technical group for people who are interested in kind of diving in some of the technical details. Those conversations are evolving and emerging. There are other groups on prevention, opioid prevention, on privacy and confidentiality, and on social determinants. And so we hope that you join us in those conversations, ask questions, post materials, and be on the lookout for some additional webinars that we'll be hosting over the next period of time. We hope to be putting out a series of webinars on opioids, particularly focused on prevention of opioids addiction over the next couple of months there. And so with that, thank you for taking time today and look forward to seeing you online soon. Okay, thanks everyone. Great day.